Hello.
Hi.
How are you this morning?
I'm okay. I'm kind of nervous about my surgery and all the things I'll have to learn.
Well, congratulations on finally finding a kidney.
Thank you.
My name is Ashley. I'm going to be your nurse today.
Okay.
So I'm sure you must be feeling a lot of mixed emotions today going into such a big surgery, but we're going to try to help you out the best we can and make sure that you get the best possible outcome. But there is a lot to learn as far as staying healthy afterwards, so we're going to try to start educating patients like you early. So I'm just going to try to give you some education before you go into surgery.
Great. I do remember the doctor saying I'll be on a lot of medications after, and I was wondering if I could ask him some questions.
Yeah, I'll actually get the pharmacist to come in here and speak with you, and she'll kind of give you some more information about that.
Great. Thank you.
Hi.
Hi.
I'm the pharmacist. My name is Sarah, and I heard you had some questions about the medications you'll be on.
Yeah, I just know I'll be on a lot, so I was just curious why I had to take so many and what they were for.
Okay. Well, you'll be on several different ones, but that's normal, and that's just to prevent organ rejection.
Okay.
So these will work. They'll selectively suppress certain T lymphocyte cell lines in your body. And by doing so, they'll prevent involvement in the immune response. So your body won't reject them, they'll accept it. So these medications might include basiliximab, which is given in injectable form, and azathioprine, which is given oral and injective forms. And they're used along with acyclosporin and corticosteroids in order to help with the whole process. And the corticosteroids are given in order to pre-medicate in order to prevent an allergic reaction to the other medicines. So just be aware that when you take these, they can cause some adverse effects, like hepatotoxicity, nephrotoxicity, hypertension, chest pains, fever, chills, tremors, headache, nausea, vomiting, dyspnea, palpitations, diabetes, skin cancer, and possible death. And also remember that they do have a high risk for other drug interactions, so you'll want to avoid NSAIDs, St. John's worts, fluconazole, rifampin, estrogens, and acids, iron, oral contraceptives, grapefruit juice, alcohol. And then you also want to make sure you avoid live vaccines and limit your UV exposure too. Do you have any questions?
I think I'm okay right now.
Okay.
Thank you.
Hi.
Hey.
How are you?
Well, the pharmacist just came in, and I'm honestly just really confused about the medication still. She used a lot of big words, and I'm just kind of scared about all of that just because I don't really know what's going on. And I also know one of my friends, she said that her system was immunocompromised, and she's on the same medication. Will that work the same in my body?
So, kind of, in more simple terms, basically your body's not going to see the organ as a foreign object, preventing your body from attacking the organ and destroying it. So these medications are going to kind of suppress that immune response so that it'll see the organ as a normal part of your body and like it's always been there, so it's not foreign or something that needs to attack, kind of like when you get sick and your immune system kicks in and it fights that. That's kind of what it would do if we didn't give you these medications.
Okay, that makes sense. Thank you.
Of course. Before I leave, is it okay if I get some vital signs and labs? We just need to have a baseline so we can compare things during surgery, after surgery, and everything.
Yeah, that's fine.
Okay. Okay, well now that I've taken all of your vital signs and I kind of have a baseline and I went ahead and inserted your IV, I've had your labs drawn, your CBC and everything. We got your pregnancy test. It came back negative, so you're good to go to surgery. I'm going to teach you how to use this spirometer real quick since you're going to be kind of groggy waking up.
Okay.
So you'll know how to use it afterwards. It's really important that you do this afterwards just so that we can make sure that your breathing is effective. So basically what you're going to do is you're going to put this in your mouth. You're going to try to get this little yellow thing up to the happy face, and you're going to suck in. So you'll breathe out your air, suck in as hard as you can, try to get it up to this line.
Okay.
Okay, so the nurse should be in here in just a few minutes, as well as the CRNA to come and go over a last minute things with you and go ahead and take you to surgery.
Okay, thank you.
Welcome.
Hi, Sydney. How are you doing?
I'm doing okay. I've been updating a little bit of my family. The surgery went great. I know the doctor said that things went well, but I am kind of scared about going home. I'm kind of worried I won't be able to take care of myself how I should be.
Yeah. Well, that is a very common fear, especially with transplant patients. But with you guys, we really try and keep you guys involved in your care in an effort to like empower you guys so that you guys feel confident in your ability to like take care of yourself. So up until discharge, we'll be like helping you, teaching you about medications, telling you the things that you need to keep an eye out for. And that way you'll be able to take charge with everything by the time you go home.
Yeah, I guess I'm just scared that my body's going to reject the new kidney. And I kind of want to talk to my family about it. Do you know when they'll be able to come visit?
Well, because of the medications that you're on, they suppress your immune system, so it makes it really hard for your body to protect yourself against different illnesses. So we have to restrict your visitors to make sure that you don't get anything until your organ is like better secure. You don't want to risk rejection. But if you want, your mom could maybe bring up your laptop so that you're able to FaceTime with some of your friends.
Okay, yeah, that all makes sense. I do have one question. If I don't have an immune system, how am I supposed to not get sick?
Well, at the hospital, we really try to take a lot of efforts to help keep your environment clean. So we'll limit your visitors. We'll all wash our hands really well before coming in. We'll clean your room frequently. But yeah, so we're just gonna try and limit your exposure. And then on top of that, I'll be watching your labs and like your white blood cell count. And I'll be monitoring your fever and looking at your incision, all of those things to make sure that we catch an infection early if it does occur.
Okay, that makes sense. Will you tell my mom that I want the laptop?
Yeah, I'll let her know that she's able to come back in.
Thanks.
Hey, Sydney.
Hi.
You're looking so much better today. How are you feeling?
I feel a lot better. I just still feel like there's so much I need to know before I go home.
I know. Well, discharge is super close, so we're going to spend some time today educating you on some of the things that you'll need to know before you go home.
Okay. And what will care look like after I'm discharged?
Well, so there's been the transplant team that's been coming every day to check up on you and make sure that you're doing okay. So after you get discharged, they'll continue monitoring your progress to make sure that everything is still looking okay. And they've done a good job teaching you about like the signs and symptoms of rejection, right?
Yes.
Okay, so if you see any of those, you need to come right back and let your doctor know.
Okay, and last question. When I go home, what will like diet and exercise and all of that look like post-transplant?
Okay, so with your diet, we try to encourage patients to eat a low salt and high fiber diet.
Okay.
We want you guys to eat like reduced fat dairy products, fresh fruits and vegetables, lean meats, whole grains, and drink a lot of water.
Okay.
And then as far as working out goes, it's actually really interesting. I feel like if I had a transplant, I'd be a little worried about working out afterwards. But they actually say that so long as you don't lift like more than 10 pounds, exercise can be very beneficial in the healing process.
Okay.
So you're able to like do as much as you feel you're capable of.
Okay.
Just be careful with the weight limit that you're lifting.
Great. Sounds good.
Yes. Well, I also wanted you to get some more education on your medications. So the pharmacist will actually be in just a minute to help educate you a little bit more.
Great. Thank you.
You're welcome.
Hey, Sydney.
Hey.
Are you ready to go home?
Yes, I'm very ready.
I heard you wanted to know a little bit more about the medications before you left and everything, so I'm just going to do a quick little review of it.
Okay.
So it's really important to remember to adhere to the medication schedule. So cannot overemphasize that enough. Just make sure you take it every day at the same time. That's super important in order for you to have the best case outcome as well as healthcare costs and stuff like that, so you don't end up back here. It's also been noted that medication non-adherence can be related to increased disease and death, so we don't want that.
No.
And once again, take it every day, same time, and don't double up on your doses, even if you feel like you might need to. Promise if you stick to the schedule, you'll be perfectly fine.
Okay. So I do have a couple of questions. Can I take my medications with meals?
You can, yeah,
Okay.
and actually taking it with food will help decrease some GI upset that you might get.
Okay, and what if I did miss a dose? Like, what do I do then?
Don't panic. Just take it as soon as you remember, unless it's really close to your next dose. in that case, probably call the provider.
Okay.
But otherwise, you're good to take it as soon as you remember. And also, last thing is make sure you keep all your follow-up appointments. That's really important in
Okay.
order that the doctor can keep up with you, and your levels can be drawn in order to test for your kidney and liver function as well.
Great. Thank you.
All right, you're welcome.
Hi, Sydney. How are you doing?
Doing well.
Okay, so the pharmacist just came in and talked to you about some of your medications?
Yeah, she was very helpful.
Oh, that's good to hear. So I printed out your discharge information, and it has all of that information written out and what you'll be taking,
Great.
how and when you'll be taking it. I also went ahead and found you some community resources that you can utilize.
Okay.
Some of those include support groups, like
Mhm.
transplant support groups in the area, and if that's not quite what you were looking for, there's also online forums and Facebook groups of other transplant recipients that can help
Cool.
you through all of this.
Sounds
So,
great.
do you have any other questions that I can answer for you?
I don't think so. Thank you.
You're welcome. Well, when you get dressed, we can wheel you out for discharge.
Okay. Thank you.